Speaking. Oh, adventures with his family he's seeking. Reporting weather, telling stories wherever he goes. It's the Ezra Speaking Show. Yeah. Thank you, everybody, for joining us today on this Ezra Speaking. We got Dr. Yancey.
Hello.
Now, you're probably thinking, huh? We got Dr. Yancey's wife. Can you introduce yourself to us?
Yes, I am Allie Yancey. I work at Riley Hospital. I'm a pediatric hematology oncology physician.
So you're wondering, we already talked to Dr. Yancey. We're talking to Dr. Yancey.
Yes.
So funny. What do you do here at Riley Hospital?
So here at Riley, as I said, I'm what's called a pediatric, which is kids, hematology, which is study of the blood, and then oncology, which is cancer. So myself and my colleagues do one or the other. So I do mostly oncology. So I take care of kids that have cancer. Specifically, the type of cancer I care for is cancer of the blood. It's called leukemia or lymphoma. But there's different kinds of cancers.
Yes. What kind of cells are in the blood?
Great question. So we have three main types of blood cells, and they're actually made inside the bone marrow, which is inside of our bones. It's kind of like a spongy part within the hard bone. And the bone marrow makes our white blood cells. Those fight off infection, viruses, bacteria, stuff. And then we have red blood cells. Those carry oxygen to the other parts of the body, the organs that need it. And then platelets help our blood clot or keep us from bleeding too much.
Like we're going to see in the
lab, we're going to see all those things.
Yes.
Yes.
So how do you spell
platelets? P-L-A.
P-L-A.
T-E.
T-E.
L-E-T-S.
L-E-T-S. Because some of these words are new to me.
Yeah. Vocabulary. I love it.
What is cancer?
Cancer is a disease where a certain type of cell in the body, and it could be a variety of cells. I'll focus on maybe leukemia because then that's a specific type of cancer. So leukemia is a cancer of the white blood cells. So for some reason, the white blood cells in our body start becoming abnormal. So they divide and divide and divide, and they're not normal cells, they're cancer cells. And then that prevents the bone marrow, which is where all the blood cells are made, remember? The bone marrow can't make normal cells because it's only making those cancer cells. So then we have really good medicines called chemotherapy that get rid of the cancer cells. So cancer is just the abnormal dividing of cells that aren't normal.
Okay.
So we try very hard at Riley to keep being in the hospital as fun as we can, because it's not fun to be away from home and have to stay in the hospital. So we have a lot of people on our team that work here that try to make it
entertain and help.
Yes, because most of the time, or a lot of times when kids don't feel well, or even when they have cancer, they actually can still do all the things they want to do. So sometimes kids ride tricycles in the hallway. They love to play video games. They love to go to the Child Life Zone. So
now,
we try to have the fun
a tricycle in the hallway, that'd be funny.
A couple months ago, we had a race between two of our doctors. So two of my friends had a tricycle race up on the 5th floor. It was really funny.
What do children get to do to celebrate when their cancer cells are gone?
Yeah, great question. So you have something called bell ringing. So we have a bell in our clinic that has a little poem that talks about finishing cancer treatment and being done with their treatment, and then they get to ring the bell to celebrate, and then they get some special things so they can remember that. It's a big deal. Yeah. Well, thank you so much.
You're welcome.
Talking with me, and those were really great questions. Thank you.
Now we are gonna go have some fun at the labs.
Yes.
So let's go.
Hi Russell.
Hello there.
This is Ezra. He's here learning about what we do in pediatric hematology oncology. So Ezra, when we see patients in this area, which is the clinic, so it's similar to, do you have a pediatrician? Do you go to the doctor? So like when you go see your doctor, you go in and you get checked out and they listen to your heart and lungs and all that. For a lot of our patients, we take a blood sample to see how they're doing or responding to whatever medicines we're giving them. And then that blood sample comes here to this lab.
So we have this sample of blood, okay, and it has a barcode on it. So when we put it in this cassette, so we'll make the barcode visible, so that the machine will put it in the machine and it'll go across and be read, and it'll slide over here, and then the machine will analyze the blood, and then when it's finished it comes out the other side. And then we get to see, then like Dr. Yancey, she'll get notified of what the results are for her patients.
Will give us a computer readout, but sometimes we do procedures on patients where we actually get some of their bone marrow. And when we do that, Russell makes a slide and he will do an initial look under the microscope, or someone that works with him
like
here.
what they do.
Yes, they do kind of they prep all the stuff and then they take a quick look, or sometimes the doctors come in and take a look, and then it goes to pathology, like someone that you met, the doctor that you met last week.
And so yes, they did say they send like the slides here and for histology here in Indianapolis.
Yes, there are some things, because you met with someone in Lafayette, right? Yes.
Dr. Zandra DeHue.
Okay, so sometimes Dr. DeHue and her colleagues send stuff to the main lab here in downtown Indianapolis. That's right. Yep. Okay. Cool. All right. Do you have any other questions about what goes on here?
Like, what do you guys like to use for the microscope of X's?
We start out at 10x so that we can get a broad picture of what is going on, and then we'll look at it even closer and use 50x with a little drop of oil that'll like make it look really pretty on through the lenses and on the screen, okay? So we'll get to look at that in just a little bit.
Thank you for showing us
thanks,
this, and thank you, Russell.
All right. So now we're going to, so that's what's called the outpatient center. So patients come to be seen, we do what we need to do, and then they go home the same day. Now we're going into the main part of the hospital, where some patients have to come into the hospital and stay for a little bit to get medicines, or for us to figure out what's wrong with them.
Here's the main green.
I call these the Jolly Rancher elevators. Don't they look like Jolly Ranchers?
Yes.
Okay, so Sabra, we thought it might be cool for her to go through. So Sabra used to work in that lab that we were just in, and now she works in a different part of the big lab downtown. It's called flow cytometry, and she can talk about that. But we use that a lot for the types of patients I take care of. But she loves to teach what's on the slides, and so she teaches a lot of our doctors that are training, called fellows. She does what's called slide rounds. So we thought, if you want, you could look at some blood cells.
What I have for us here is just a normal peripheral blood smear, which is our, when we take a teeny tiny drop of blood and make a very thin slide, okay? So you know how we were talking about the 10x and the 50x?
Yes.
Well, right now I have it on 10x, and that gives us a broad picture of what is going on the blood smear. But what we're looking at here is, see all those big purple dots?
Yep.
Those are our white blood cells, okay?
Like right here. We're seeing these.
Now we can see these up close. Do you see that? So I have a great field here. So we can look on the screen now. So all these little pink dots, those are our red blood cells, and those carry oxygen from our lungs to
like all of these right here.
All the things are shaped kind of like a disc.
And then these purple dots?
The purple ones, those are our white blood cells. And the one that you have your arrow on, that one is called a neutrophil, and it fights off bacteria. Okay? And then this one over here is another white blood cell that looks a lot different from this one, right?
Yeah.
This one fights off viruses. Okay? And do you see all these little purple dots here? The ones that I'm pointing at, the tiny?
Yes, the tiny
The
ones.
tiny purple dots? Those are our platelets. And those keep us from bleeding. They form a clot for us. If we get injured, when we get cut, they go to the site of that cut and they form a cluster. Okay? Now there's one other cell I want to find. Oh, and I found it. He's here. This guy right here, this one right here, that is called a monocyte, and he's a garbage eater. Okay, he'll go around and eat cellular like debris. Like when the cells start to break down, he'll go around and gather that up. Okay, so those are all of our normal blood cells.
Now, can we see the 100x?
100x, yes. That'll get us really close up, won't it? Very good.
So this is a garbage eater.
That's a garbage eater. Very good. Let me get it into focus. There we go.
And then this is the white blood cell.
That is a white. All three of these are white blood cells. The one that you have your arrow on is called a lymphocyte, and that cell fights off viruses. The big one is the garbage eater.
That's the garbage eater.
And then the one on the right will fight off bacteria. Do you see how it has all those like little little shiny spots in there?
Yeah.
Okay, well those have chemicals in them that get released and help fight off our the bacteria if we get a bacterial infection.
Good.
Yeah.
Alrighty.
Do you have any other questions for me?
No, I think I'm good.
Okay, good. I'm happy to show you these.
So there are people that work in the hospital that are called child life specialists.
Yes.
And have you heard of them?
Yeah,
They-
we did. We did an interview with the child life specialist.
You did? So you know, I mean, you know all these things. So they are so important for kiddos in the hospital. We're going to this place called the Child Life Zone.
Yeah.
So it's kind of part of our child life department, and it's this really fun place. You'll see it, where patients can go, whether they're
is
here.
that?
Oh, this is part of it. See, this is the outside part. So. They can go and ride cars, you can race cars, there's a little playhouse. Okay, where'd you
That's
go?
a
Oh my gosh, you're so
special
quick. I thought you were on that
That's a
side.
special moment for me.
That is really cool.
Hi, we're just doing a little tour. Yeah. This is Ezra. Hi, Ezra. Very cool.
Yeah.
Well, my name is Meg, and I'm also a child life specialist, and this is our child life zone. And so in here, this is a spot where boys and girls, if they're staying overnight at the hospital, if they want to come down here and play, we have air hockey, we have foosball, we have pool, we have a PS5, Xbox One, Nintendo Switch.
You have a pinball machine.
Yes, and now we have a pinball machine. It wasn't here for that last week, but we have
What's a
it now.
pinball machine?
You don't know what a pinball machine is? Oh.
Well, let's go check it out.
Can we see?
It's
Oh.
Avengers themed.
How do you get it to be free?
Project Pinball.
To be-
That's all their ideas. Just like the other foundation that gave us our touch tune, so boys and girls can pick their own music. They wanted to make sure that the point of it is to make sure that you guys can have fun when you're here in the hospital, and you can, doesn't it make you feel better when you can make your own choices?
Yeah.
It makes you feel like you're more in control.
Really?
Yeah, and so you can choose what songs or what music you want to listen to. You can choose to play the game, and you don't have to worry about spending any money on it. If you want to do it, it's
Cool.
here for you to do. That's what the zone's all about. Choose your own adventure.
Choose your own adventure.
We're gonna go to
We're going to 5. 5. All the way up. Okay, look at your dad. I wave to him. Are you okay? I thought you weren't afraid of heights. Are you a little bit?
I'm a little bit.
A little bit. I know, it's okay. You just hold on. So this is what's so cool. Because before we redid this part of the hospital, see these like blank hallways? That's where those doll houses used to be.
Hey, that person done level.
We're going all the way up. See? Isn't that cool? Cool, huh?
Are we gonna? Hey,
We can take the yellows.
yeah, let's take the yellow. very fun.
That was super fun. I loved your excitement.
Yes. All right. Now, we know that Dr. Yancey has signed my shoes. So would Dr. Yancey like to sign my shoes?
I would love to sign your shoes.
Thank you, everybody, for joining us today. Please make sure to follow the Riley Children's Health on Facebook. Thank you, everybody, for watching today's video, and where we got to discover about the blood. Thank you, everybody, for watching today's video. Remember to like, share, and subscribe this video. And thank you for joining us today. See you later. Bye.